3 to 5 pairs of sacral, a couple pairs of coccygeal. All right, now if we look at the thoracic ones, you see they basically go straight out. And if you remember, structure of a rib, it seems like that was a long time ago. But remember, each rib had the costal groove underneath it, right? Which was a passageway for nerves and blood vessels. And in fact, those intercostal nerves run through there. If we open our book, and we look on, I'm going to turn right to it. It's like you're looking for Psalms. Let's go right in the middle of the book. Yeah, it's figure 13.7, what other page that's on. Okay. It shows you a map of what are known as the dermatomes. Okay, and what this is are the regions of skin that are innervated by each of the different spinal nerves. Right? So the touch or other information from the skin, you can see it there. And again, you see that segmented body pattern. That kind of looks like a centipede right there. So you can see how they're just striped along the thorax and then in larger regions in the limbs. Notice the face is absent because that's innervated by the trigeminal nerve, a cranial nerve. Okay. All right. Now, that's significant because pretty much every human on earth is infected with some form of a virus that infects these sensory neurons. They're called herpes viruses. There's different varieties of them, like herpes zoster, which causes chickenpox and shingles, and then the herpes simplex viruses, which cause herpetic lesions, mainly around the mouth and in the genital area, which we call genital or oral herpes, or cold sores. Now, in particular, herpes zoster, which causes chickenpox and shingles, is a particular source of misery, especially for older people. When it comes back in that form, it usually causes not chickenpox, which are relatively painless, but shingles, which can be extremely painful. Okay? If you've ever seen somebody with an eruption of shingles lesions, they're usually not all over the whole body, they're confined. And in some cases, if they're in the thorax, they'll be like a stripe, right? That's a dermatome, because you have one set of ganglia have the viruses become non-dormant, right? They go into a latent phase, and you never get rid of a herpes infection, because what happens is the viruses go in and integrate themselves into the DNA of those cells. And then when they come out of latent phase, they come off of the DNA and they start making copies. That's why most people who are infected with genital herpes never know it. They never have any lesions, but they can still shed virus and infect other people. Okay? People make way too much of a deal out of that because everybody's got some form of herpes. Yeah.
So how would you, like, let's say someone was a carrier, how would they stop it to be passed?
You can take drugs, the antiviral drugs, which are used to, if you have like bad cold sores or genital herpes outbreak, you can take these drugs which limit viral reproduction. They're very good. They have basically no side effects, because what they are nucleotides that are only used by the viruses, and they're forms of those nucleotides that they can't use. They incorporate them into their DNA and then it's non-functional. So it's extremely effective. So you just take whopping big doses of these every day, and it doesn't do anything to you. But it dramatically reduces the chance of spreading those herpes to a partner.
So I have a question.
Mm-hmm.
Is it that like whenever you put this on your mouth, you get like more than like the other ulcers inside your stomach? Like I've read that.
I don't think that's true of everybody. You can get, I know you can get them in your mouth. Can they be in your stomach? I don't know. Sometimes, like dentists used to get herpes lesions on their hands, but before they started wearing gloves, they would get these herpetic lesions on their hands.
Well, I've always heard like if you have ulcer in your mouth, it says like it indicates like there's like a problem going on in your stomach or in your digestive system, like it you like that.
Well,
So, I mean, like,
Sometimes it can be related, like if you have Crohn's disease, one of the symptoms they look for in Crohn's is like cold sores or like little ulcers on your skin. Like if you have Crohn's, you'll have like little like
well,